Do you struggle with elbow complaints? And by elbow complaints, it can be tennis elbow, golfer's elbow, or it may just be elbow pain and discomfort that you've never had formally diagnosed from a health professional. If you do and you're an office worker, there's every chance that something that you're doing whilst you're sitting at your desk is the cause of this complaint. The elbow pain and discomfort that you experience may not occur whilst you're sitting at your desk. You might notice it when you try and lift heavy shopping bags. You might notice it when you try and lift your child out of the cot. You might notice it when you play sport on the weekend. Pain and discomfort that occurs outside of the office can absolutely be caused by something that you're doing inside of the office. At ERGO Collective, we believe that most people's body complaints come from their poor, static postures. And where do you do most of those? At work, of course. It's really important to think about the ergonomic, the postural, and the behavioural considerations that you do every single workday and how these contributing elements can be the cause of your elbow complaint. So let's have a little bit more of a chat about the anatomy of the elbow and teach you a bit more about how it's designed to work. And then we will offer some suggestions as to some ergonomic, postural or behavioural elements of your work day that can be the cause of the elbow pain. Okay, let's talk about the anatomy of your elbow. So your elbow is a hinge joint. It goes forwards and backwards and it has the degree of rotation either inside or out. When you sit at your desk, where the most stable position for your elbow to be to minimize stress and strain through your elbow is at 90 degrees flexion. This is the single most efficient position that you can keep your elbow in on over the course of the day to minimize stress and strain on your elbows. When you're in this position, there's actually not that much muscle input to maintain this position because it's a really stable position. Where you run into trouble with elbow complaints is when your elbows start to leave your side. This is problematic because when your elbows leave your side, all of a sudden the effects of gravity are more significant. You can imagine as your elbows leave your side, the further from your side they go, the more gravity wants to pull them down. So to combat the effects of gravity, what has to happen is that your muscles have to switch on to balance the effects of gravity. This is fine from a very short-term perspective, but if you've got your elbows away from your side for prolonged periods of time over the course day, what ends up happening is you have to recruit those muscles all day to combat gravity. And what that does is it leads to a lot of fatigue and muscle soreness because it's just not using the muscles how they're designed to be used. Tendonitis, bursitis, golfer's elbow, tennis elbow, all of these sorts of complaints are basically overuse injuries. So as soon as your elbows leave your side, what happens is you recruit those muscles and you recruit those muscles which are sprint muscles to do an ultramarathon. And that's why you end up in trouble with elbow complaints while sitting at your desk. So fundamentally, when you are sitting at your desk, what's vitally important is that your shoulders should hang passively by your side. Your elbows should be bent at a nice 90-degree angle and you shouldn't be reaching for the keyboard or the mouse. The first ergonomic consideration and probably the biggest cause of elbow complaints is that the mouse is too far away from you. As we were just discussing, as soon as your arm leaves your side, you end up having to over-recruit muscles. So if your mouse position is far too far away from you, you end up over-recruiting the musculature around the elbow to maintain that position. And this is where you end up with elbow complaints. In a similar vein, the keyboard being too far away from you is also problematic for elbow complaints. So please just ensure that the keyboard is positioned 5 centimeters in from the lip of the desk because that's a great position for it to be in. Another ergonomic consideration in terms of elbow complaints is your chair height. It seems a bit strange, but think about it. The lower your chair is, the more you have to hitch your elbows up to get over the lip of the desk to reach for your keyboard and your mouse. As soon as your elbow leaves your side, as we've discussed, you run into trouble. So review the height of your chair to make sure that when you're sitting up nice and tall and straight, that your elbows clear the height of the desk. If you use a laptop for any excessive periods of time, you need to get a secondary mouse. The trackpad positioning forces your elbow into this really abducted position. As you can see in this video, it's a nasty angle that you're promoting through that elbow simply by using a trackpad. If you do use a laptop, it's really important that you use a secondary mouse. An indirect posture that affects elbows is when we side shift at our desk. As you can see, as my body weight shifts to the left, my dominant mouse hand has to extend and wing to the right to accommodate the mouse. The further left we go, the further right our elbow has to go to continue to use that mouse. It's really important if you do struggle with elbow complaints that you monitor your torso position relative to your arm, because it may be causing a winging behaviour. When you talk about behavioural considerations, the biggest cause of elbow complaints is simply chicken winging your elbows. You might have all the ergonomics in the right position, but we have this predisposition just to simply chicken wing our elbows when we use our keyboard and mouse. So from a behavioural perspective, it's really important that you're just aware of what happens with your arms when you're working. Your arms should be hanging passively by your side and your elbows should be right next to your side. We've talked a lot about chicken winging with your dominant hand and your mouse hand, but what you've got to be really conscious of, if you do have elbow complaints in your non-dominant hand, there's this predisposition for people who do a lot of typing to chicken wing their non-dominant elbow. So if you are a typist and you are struggling with elbow pain in your non-dominant hand, just check where your elbow positions are when you are typing, because they may be straying far from your body. Another behavioural consideration in terms of elbow complaints is reaching for the mouse. As we've discussed earlier, having the mouse positioned a long way away from you is a problem. However, what we can do is we can start off with the mouse in the correct position at the start of the day, but as the day wears on, what happens is the mouse can slowly creep away from us, and before you know it, it's halfway across the desk by 3 o'clock in the afternoon. To combat this, a really easy option would be to either use a mouse pad or fence the mouse in, which is where you put a really heavy folder at the top margin of the mouse and you put a really heavy folder on the lateral margin of the mouse and give yourself an A5 parameter to work within. As your arm starts to reach away and the mouse creeps away from you, what you're going to do is physically hit that barrier, which will alert you to the fact that your arm is reaching further and further away, and it will just connect you in with your body and make you realize that it's creeping away, so you need to rein it back in again. So reaching for anything is a really problematic behavior for elbow complaints. As you can see, how you sit at your desk over the course of a work week is really important in maintaining really good musculoskeletal health. Fundamentally, in your body, every joint, ligament, muscle, tendon, bone, it's all got a really specific role, and if you use it how it's designed to be used, generally it'll look after you. What we're hoping is there was something in this video that jumped out at you, whether it was a behavioural quirk, whether it was a poor posture, whether it was an ergonomic issue. What we're hoping is one of those things jumped out at you, and if that aligns to your body complaint, there's every chance by addressing this and fixing this, your body complaint will settle down. If that wasn't the case and you're still a little bit unsure, what I would suggest is to continually just check yourself over the course of the day. What is my head doing? Where is my elbow? What are my feet doing? If you can continually check in with your body over the course of the day, you'll actually realize that you have a lot of consistency in terms of your postures and behaviors. And if you can identify those quirks and change them, generally you'll find that your body is in a much better position. If you would like a little bit of one-on-one attention, what I would suggest is booking for a clinical assessment with one of our staff. That way we can go through all fractions of your life to try and ascertain the cause of your complaint. Sometimes it's a little bit complicated and sometimes it's not easy and straightforward. And this is where a formal clinical assessment with one of our staff is probably the best idea for you. At the end of the day, how you sit at your desk affects your body both inside of the office, but actually more importantly, what it does outside of the office. At ERGO Collective, we're your partners in office health.